project on healthcare in correctional facilities. 10.3 million people are incarcerated worldwide. 2.3 million of these people are incarcerated in the United States. This means that the United States is the largest incarcerator in the world. With this many people incarcerated, most of the American prisons are overcrowded and understaffed. Many state and federal prisons occupy more inmates than they initially intended. These conditions essentially translate to low quality of life, especially in health matters. The health disparities in American correctional facilities are very concerning. Asthma, mental health issues, hypertension, and drug dependence are significantly prevalent in the U.S. prisons. In addition to these health issues, there is a mainstream concern of prison rape. An estimated 200,000 individuals are subjected to sexual assault every year. These numbers are higher than the reported number of cases in European countries. Most correctional facilities lack equipment besides understaffing of the health department of most prisons. 95% of all incarcerated inmates will eventually be released and reintegrated back into society, which causes the urgency in reforming the healthcare policy. Unfortunately, budgets for prison healthcare systems have been on a gradual decline over the last decade. 3 out of 5 people in the United States prison systems are not able to read. Additionally, 85% of all juvenile defenders have some form of difficulty reading. The competitive nature of the U.S. economy places uneducated individuals at the social mercy of criminal behavior. Often, ex-convicts are not easily employed, more so the ones that cannot read or write. A recent study conducted concluded that over 68% of all released convicts were rearrested and sentenced. Over 76 of all released prisoners in the U.S. are arrested within the first 5 years of their release. Arguably, improving the education standards of the country, especially investing in prison-based education, would serve to reduce the number of repeat prisoners in the United States. From a policy-making perspective, the higher the numbers of enrollment in prison-based educational practices, the fewer inmates incarcerated in prisons. In this regard, the overall cost of maintaining correctional facilities will drastically drop, resulting in the ultimate increase in the healthcare funding for prisoners. Approximately more than 35% of all incarcerated individuals in the United States are in prison for substance-related charges. The war on drugs heavily influences the current healthcare predicaments in the United States correctional facilities. Healthcare spending by prison authorities varies from state to state. For example, Louisiana prison spends $2,173, while California spending was almost $20,000. The average spending currently lies at $12,000 per person. For prisoners to be fully rehabilitated, it is essential for more investment to be made in healthcare. If healthcare reforms are incorporated into the nation's budget, then a higher economic implication would be invoked in the American economic environment. Americans and companies on American soil earn on average $36.17 trillion every year, with a total tax liability of $3.3 trillion. These figures place the average taxable percentage on income at around 14%. Around 3% of that is spent on health care for people both in and out of prison. On average, the U.S. government borrows around $3.2 million every minute to meet the deficit on required spending of $3.9 trillion annually. In order to meet the $250 million deficit on spending in prison, taxes must be increased or borrowing must increase. Increasing taxes could translate to an increase in the cost of doing business in America. This increase would essentially translate to an increase in the prices of goods and services in the American economy. Earlier this year, President Trump declared his support for prison reforms. This act was one of the most praised actions of the president's term in office. Currently, it is estimated that 33% of all prison population in America effectively identifies as Black. The Caucasian community accounts for second with 30% of the population, and the Hispanic community is third. These figures represent a declining trend in the prison racial divide. This shows that the prison system is no longer a racial issue, but it is now a national issue that transcends through all political classes and race. Reforms of this nature would translate to an unusual unification of the political divide in America. Healthcare reforms are heavily influenced by the current state of affairs in the American correctional facilities. America hosts less than 2% of the entire world's population. However, it hosts more than 25% of the entire world's prison population. Most incarcerated people in America are those who lack the financial muscle to pay for fines and large legal fees. Because the crime rate was at an all-time high in the late 1980s and early 1990s, the U.S. government imposed harsh legislation against crime that incarcerated a huge bulk of American lawbreakers. However, in doing so, this placed numerous Americans behind bars. In this regard, the overcrowding and understaffed nature of prisons in America have resulted in the deplorable health conditions we know today. These factors heavily influence the need for reforms in the American prison system's healthcare policy. These changes in the medical policy and the correctional facilities would translate to an increased responsiveness to the minor medical incidents, more effective medical checkups and evaluations for the incarcerated, and more effective detection of healthcare issues among inmates, which would result in a better environment for rehabilitation of the inmates. The correctional facilities are understaffed. Recent budget cuts on correctional facilities resulted in almost 3,100 jobs lost and around $250 million in government spending. However, medical care for prisoners would increase the need for more healthcare professionals and more mental health care professionals working in correctional facilities, and more rehabilitators helping incarcerated individuals prepare for their readmission to society. As mentioned before, if these reforms became a policy, there would be a need for the appropriate recruitment of healthcare professionals. From psychotherapists to physicians to other mental health care professionals, the number of people needed to implement this policy would be immense. The public would benefit from healthy, rehabilitated individuals readmitted to society. Such healthcare reforms would reduce the crime prevalence in the United States. The government would not benefit from this policy. The government agencies would be responsible to outsource for additional healthcare professionals and the equipment needed to realize the policy. They would be responsible of ensuring the policy is adequately and properly funded. In this regard, the American government would have to look for additional funding from an already deficit budget. However, there are many advantages outweighing the disadvantages. Some advantages are improving of the state of affairs in correctional facilities. Inmates would experience better health conditions and better rehabilitation. A healthy prison population has a huge potential. Healthcare professionals and social workers would be able to positively impact society through improving the lives of incarcerated individuals in prisons. Additionally, there would be newfound exposure to the prison system to explore the inexpensive researched and undocumented aspects of the prison lifestyle, including sexual assault, gang affiliation, and other pertinent issues in correctional facilities. The US is behind prison reforms because this method has recorded similar or even more successful rates than other countries. It has been successfully applied in France, Germany, Denmark, and many other countries around the world. It is a proven fact that these reforms are both beneficial to the society and the prison systems. This global trend shows how these reforms are overdue and necessary in the American prison system.